Good morning, Dr. Burke.
Good morning.
How are
Glad to be with
you?
you. I'm great. How are you?
Oh, we're
Just
wonderful.
at the tail end, you're talking about feet being too big for your shoes.
Yes.
Yeah.
Oh, well, that I was saying, I don't know if you were on yet, but I worked in Macy's shoe department for 12 years, and women always wanted smaller shoes. And,
Right.
and I would tell them, your foot, and they would get so upset. No, this is my size. This is my size. And then I said, we always have to fit the bigger foot. Well, one foot, they were so adamant. But it's true.
Right.
Was I right or was I wrong?
Absolutely. And, a lot of people will buy shoes expecting them to stretch or have the shoe conform to the foot. But in fact, our foot will conform to the shoe, and especially over years. That's what causes bunions and hammer toes. No, our foot conforms to the shoe, not the other way around.
What causes a bunion?
Yeah, bunion is just wearing ill-fitting shoes, too tight in the toe box, too pointed, and constant pressure on the big toe, pushing it the wrong way, and over years, the bones actually remodel and reform under that tension.
And is it more common in women than men?
Yeah, because of the shoes and the fashion. It's interesting that if you go back thousands of years in other cultures, like the Chinese have this history of foot binding and infant girls. There was this small, dainty, almost incapacitating feet were a sign of affluence. And fast forward to, our Western culture, there's still this connection to torturing a woman's foot in the name of fashion as a sign of affluence. That's just an interesting connection that seems to play out across cultures.
All right, so you're here with us today, and Joel and I are very interested in this about feet, but not just fitting of the shoe, but diseases or things that can happen to your feet. Like if your feet hurt, it's not because you've been on them all day. It could be, but there could be other problems.
Three top causes of foot pain in the U.S. anyway really are sprained ankles, but it's just an acute trauma. Diabetic neuropathy, where chronic diabetes over the years, unless you have really tight sugar control, starts to affect the nerves in the foot, and it's very painful, chronic pain and tingling in the feet. And plantar fasciitis, which affects 5 to 6 million people a year in the U.S.
What is that?
And about
What is
twice as
plantar
many women.
fasciitis?
Well, the bottom of the foot has an arch, and the bones form an arch just like an old Roman aqueduct there to support the enormous weight. And connecting the front bones to the back bones is this tough, fibrous connective tissue called a fascia that's helped distribute the weight. When you take a step down, you're generating 1,000 pounds per square inch, which is about the same force that an Olympic heavyweight boxer, his best punch generates about 1,000 pounds. So every time you take a step, you're really having to dissipate a lot of force. And the arch and the fascia as a unit does that pretty seamlessly.
Well, you know what? You just taught me something new, because I always thought, I never knew what this was, but I always thought that was some kind of skin thing, like where the soles got really tough on the bottom.
Well, where this fascia, this connects to the heel bone. It's very close to the surface of the skin. And standing on concrete floors, poor fitting shoes, being overweight, 10,000 steps a day, that repeated trauma, it starts to cause a little inflammation. The connection gets pulled or tugged, and it swells a little bit. Then you start to get some irritation, and then it becomes a chronic problem. The tissue starts to break down, and that's plantar fasciitis, and it's excruciating. You characteristically take that first step out of bed in the morning, it's like stepping on a nail.
Is there a cure for that, or what can you do to help something like that?
Traditional treatments are stretching and physical therapy and roller balls and exercises, and generally they will help, but it can often take months. Now, the lead author on a study. We just did a clinical trial looking at a plant-based solution that's applied topically to the skin. And it was a year-long study, and nobody was more surprised. I was hoping maybe 50% of the people would get some response to this, but I got a dramatic improvement in over 80% of the participants in the study. So that was, in the medical field, anything that gives you an 80% response is really spectacular.
Oh, that's tremendous. Now, I'm going to ask you a personal question. Not personal on you, but personal on me. I am a barefoot person. I only wear shoes if I have to. I mean, all year long, we live in New Jersey. Even if I have to go out for the mail, I'll walk out in the cold barefoot. Is it doing me damage walking around barefoot besides maybe having to step on a nail or something like that?
No, in general, barefoot is good as long as you vary the surfaces you're walking on. If you were walking all the time barefoot on concrete, it would be worse than with shoes. But in fact, barefoot on different surfaces like grass or the beach, it flexes the foot, and there's little variations in the surface. And it also electrically grounds the body, just like an electric circuit, that third prong and the wall outlet. You have to keep your circuits grounded. Turns out our bodies have minute electrical circuits and currents, and when we're barefoot outside, we get grounded to the earth over time. And some recent studies show that can have good improvements for overall health and mood. So barefoot is good.
Because I've seen in the gym, and I just don't like the way they look. These new, I don't even want to call them sneakers, but people are wearing on their feet in the gym things that actually go that in between the toes. It's almost like it's not a sock. Do you know what I'm talking about? It's supposed to give you a natural feel in the gym, but it almost looks like water shoes, but they go in between the toes.
Right. That's the kind of footwear that I think would be appropriate in a park or on the beach. I wouldn't wear anything like that in a gym. There's way too much opportunity for getting something dropped on your foot.
That's what I thought too. I mean, you drop something on, because there's no protection. It's just basically you're covering your foot, and it's just, okay. Well, you offer expertise in natural medicine, and you've published multiple clinical trials in this areas. How so, and what does that mean?
Well, I've been interested in, what properties some of these essential oils have for a couple of decades before they were really well known. In my mind, there's, the only valid dichotomy in medicine is between what works and what doesn't. And, if a natural treatment isn't working, it's not worth pursuing. And if a traditional treatment doesn't work, it shouldn't be pursued either. But these plants are just tremendous biochemical factories. And, these oils are very robust chemically with all kinds of, to my mind, really interesting little structures in them. And so the first product or formulation I put together was, when my daughter, who's 4, had a skin condition called molluscum. And this is a contagious viral skin condition. It's very unsightly. It's not dangerous, but there's no medicine to treat it. You have to scrape or freeze these ugly-looking bumps, and that's painful.
And they were all over her body or on her feet?
No, these were on her body.
Okay.
And so the formulation with essential oils and some minerals worked, and I never imagined that, the product would go on to, help 1 million children being sold on the shelf in Walgreens.
You hold 2 patents for that, right?
I do. And that, it just really solidified the idea that natural tends to be safe, not always, but generally tends to be easily and widely available, inexpensive, and if you can get it to be effective, that's like the perfect combination. And it's often sorely missing in, traditional treatments, which when they are effective, rarely are they inexpensive.
Okay. Well,
So,
go ahead, Dr.
yeah.
Burke. I'm sorry.
Oh, that just continued the interest in, studying the research and conducting research. So the treatment for plantar fasciitis came up when a close friend had it, brought up memories of my own experience with it, which I would never care to repeat.
Mm-hmm.
And so the formulation, we tested it and turned it into another product. So it's called HeelAid.
HeelAid?
HeelAid.
Uh-huh. And where can this be found?
Our website,
Yes.
HeelAid.com, and we're in discussions now with Walgreens to get it on the shelf in maybe next spring.
So all they have to do, all listener friends have to do is go into the internet, HeelAid.com, HeelAid.com, and that'll lead them directly to you or about the HeelAid?
That'll lead to the website. We have some videos, some information on, tips to keep your feet healthy, more information on plantar fasciitis, and information on the topical formulation.
All right, I have one more question for you, because I know two people that have a lot of problems with this, and also I'm sure there's other people. Ingrown toenails. Well, I heard your voice. My grandson, who is only 13, actually had to have the big toenail removed. It was so bad.
Right.
And I have a friend that has been, she's soaking her foot twice a day. She is a type 2 diabetic, and she just can't get rid of this infection. What causes ingrown toenails?
Ingrown toenails are strictly a problem of cutting them too short and rounding the corners. You got to cut your toenails straight across. You don't want them rounded like your fingernails. People think fingernails and toenails, you cut them the same way. It doesn't work. So let your toenails be cut straight across. If you want to get a pedicure, you can have them rounded a little bit, but you got to keep the edge of the nail away from that skin fold or it gets infected. And that can be a real tragedy in a diabetic. They're slow to heal. You get infection down there. Blood supply is not so great. Can even, worst case scenarios, if the infection gets bad enough, get in the bone, you end up losing the toe. So that's really important with diabetics to put the health and safety of the foot in front of trying to have better looking toenails.
Well, I know and I was shocked. I didn't know a toenail would grow back. My grandson's toenail grew back beautifully.
Yeah, well, he's young, so that's always in the favor of getting, normal-looking things growing back and restored function.
Well,
I don't think he'll want to repeat that. That tends to be painful.
It was painful, and it was ugly. It was very, very ugly. All right, well, Dr. Burke, again, I want to tell our listener friends, HeelAid.com. It'll give you all kinds of information on your feet, and you really do have to take care of your feet because, you use them every day. They take care of you. You got to take care of them. We want to thank you for being with us today. And
it was my pleasure. Enjoyed it.
And when HeelAid hits the market, like you said you're in the works with Walgreens, we'd love to have you back.
Okay, I'd be happy to come back.
Thank you, Dr. Burke. Have a